Anesthesia. Anesthesia is the loss of sensation with or without the loss of consciousness. Anesthetics include anesthesia. There are different routes that we can give anesthesia through. Local, spinal, inhalation, IV, and topical are a few. General anesthesia includes 4 stages: analgesia, excitement or delirium, surgical, or medullary paralysis would be stage 4. Inhalation anesthetics include things like methoxyflurane, enflurane, isoflurane, desflurane, sevoflurane, usually combined with a barbiturate, a strong analgesic, and a muscle relaxant. These can be used prior to surgery. These types of medications, I think in order to remember them, I don't maybe remember every single name that's in here, but they sound kind of like a refrigerant. So I think the methoxyflurane, all the fluranes sound like they're a refrigerant product. But anyway, these things have adverse effects like respiratory depression, hypotension, dysrhythmias, and hepatic dysfunction. Malignant hyperthermia is a rare side effect that can happen. Malignant hyperthermia is something that's a rare life-threatening condition exposed to by things like general anesthesia. So specifically with these kinds of volatile anesthetics. It's a disorder that is autosomal dominant. So if people have this in their family or have had it before, they are going to have it again or are very likely to have it if they've had it in their family. So you want to be really careful with that. And once somebody's had malignant hyperthermia, they never get these meds again. Local anesthetics block pain at the site where the drug is administered. Consciousness is maintained, like things like dental procedures, suturing, some minor surgeries that are very localized. They block the nerve impulses below the insertion of the spinal anesthetic, and sometimes diagnostic procedures can be done, like a lumbar puncture or a thoracentesis can be done this way too. There are 2 groups. There are the esters and the amides. And a lot of times you're going to see the ending cane on them, things like novocaine, xylocaine. If someone's allergic to one of the canes, they're allergic to all of the canes. And there's, of note, you need to know that these medications can cause some toxic cardiotoxicity and problems with the heart. So to remember that, cocaine, I've never seen anybody who's done cocaine who has a great heart. Then we talk about some intravenous anesthetics, things like propofol, etomidate, ketamine. So these have rapid onsets and short durations. They're very helpful in sedation procedures. Things like resetting an arm, midazolam, Versed, and propofol can both be used. So those can be used in induction and maintenance of anesthesia too, or conscious sedation for minor surgery or procedures like mechanical ventilation or intubation. Patients are sedated and relaxed, but when they are under conscious sedation, they're responsive to commands. Topical anesthetics, we use these on mucous membranes, broken and in unbroken skin surfaces, burns, and different areas, places where we're going to put IVs, places where kids are going to get a local anesthetic so that they don't feel that shot going in. These decrease the sensitivity of nerve endings of the affected area. Again, watch out for the canes. Once you're allergic to one, you're allergic to them all. Spinal anesthesia and spinal blocks are interesting to talk about. Local anesthetic is injected into the subarachnoid space at the third or forelumbar space. Side effects and adverse reactions can include respiratory distress, headache, and hypotension. Just remember that story I told about when I had my babies. So anything that goes in this area can cause you to dip your blood pressure. The preoperative visit by the anesthetist and or the preoperative visiting nurse is an important stage in gaining the patient's confidence. So you want to make sure that they are able to visit early enough and are able to educate the patient well enough about these. So some of the blocks we can split up and talk about separately. There's a spinal block, which is a penetration of the anesthetic into the subarachnoid membrane, the second layer of the spinal cord. Epidural is placement of the local anesthetic in the outer covering of the spinal cord, the dura mater. And then a caudal block is placed near the sacrum, and a saddle block is administered at the lower end of the spinal column block to the perineal area. Anything that refers to that saddle area is referring to basically to a horse, and because the nerves coming off of your spine look kind of like a horsetail, and they look even more so in certain conditions like an incomplete spina bifida and things like that. But so a saddle block blocks that perineal area. Ballast anesthesia is something that we briefly touch on. It may include a hypnotic given the night before, pre-medication with an opioid, analgesic, or benzodiazepine, plus an anticholinergic given about 1 hour before surgery to decrease secretions. A short-acting barbiturate, such as pentothal, an inhaled gas, often a combination of nitrous and oxygen, and a muscle relaxant given as needed. So it's kind of like when we talk about balanced anesthesia, we're really talking about the perfect recipe. So ADPI anesthetics. So when we're talking about ADPI, we're looking at the old nursing process. So assessment, nursing diagnosis, plan, intervene, and evaluate. So assessment, we want to, and interventions and evaluations, we want to monitor the patient's level of consciousness, monitor vital signs such as respiratory rate, heart rate, and blood pressure. We also want to make sure that their respiratory status and their cardiovascular status is okay. Not just watching their respirations, we also want to hook them up to a SAT probe. We also want to put them on the cardiac monitor. We also monitor urine output. A lot of things can go wrong with that for a number of reasons, not just the meds. And then administer analgesics cautiously until the patient fully recovers, especially when they're extubated, which means that tube that you had for them being intubated has been taken out, and or if they're in some kind of a procedure even where they're in a conscious sedation. Nurses in a conscious sedation, there is an RN always, just there to make sure that the patient can be monitored and is safely above the normal respiratory rate, respiratory status, and their cardiovascular status is okay. Alrighty. And that is it for the anesthetics.